Hi, my name is Lupi Romero. I'm 50 years old and I'm living with pancreatic cancer, diagnosed February 11th of this year. And I really think that stress aggravates or induces side effects of chemotherapy. I just went through a stressful time, not this last Wednesday, but the Wednesday before. My husband was admitted to the hospital. He had esophageal varices that bled. And in the past, he's had these in the past, but the last time he bled was 6 years ago. He has very advanced liver disease. Although he's amazing, he's a very strong person. He pushes himself, and he really helps me. He's been a great example for me because he never complains. I know that most of the time he doesn't feel well, and he could be in excruciating pain, but he never complains. And he just keeps moving. Even now, he just got out of the hospital on Friday, and he's in the back watering my plants. He's back to his normal routine, and I keep telling him not to overdo it, and he says he's fine. But so he was just discharged on Friday, but I noticed he was in the hospital for a total of 9 days, and in those 9 days it was a very stressful situation because I had my chemo 2 weeks ago on Tuesday, and so the second day on Wednesday was when he was in the trauma room. They called a red trauma, which is a very serious trauma. It's one of the worst traumas that you can possibly have at my hospital. That means somebody's literally bleeding to death. And so I was at work. He called me and he said, honey, meet me in the emergency room because I'm bleeding a little bit. Right at that moment is when my stress started, because he doesn't go to the emergency room unless it's serious. So I was outside of the emergency room. I waited for him. He pulls up, and then when he pulls up and he stops, there's this bucket of blood, and he just was vomiting this enormous amount of blood. So I walked him to the inside of the emergency room, and they took him in right away, and they took him into the trauma area, and they allowed me to come in there, and they were working on him. And they tore off his 2 shirts and his pants, and so they were working on him. And I had my moment before I went into the trauma room, but when I went into the trauma room, I was very calm, and I just kept praying that these doctors, God would send these angels to guide these doctors and for them to do the best that they possibly could. And it just was like, it's hard to explain. It just wasn't like peaceful, because there were like 20 people, different people in and out of there, but it was peaceful. The doctor in charge, he was just directing everything, the trauma doctor, everything and everyone. And so people stayed calm. They all did their jobs, and they did them calmly, and they did them correctly. Then my husband was stabilized, and he was taken up to the ICU, where they tried to band the esophageal varices, but they couldn't. And that made me really nervous, because his doctor, Dr. Fang, Jack Fang, here in Mission Viejo, is a really good internal medicine doctor, and he had banded my husband in the past. So for him to come and tell me that, he couldn't stop the bleeding, that was pretty scary. So then they had to take, that same day, they took my husband down to the radiology department where I work, and Dr. K did a TIPS procedure on him, and so we were there on Wednesday till like almost midnight. His family and my family were there. We had that wonderful support, but it was very tense moments. And then we waited for him to come out of the IR. And then when he came out, he looked pretty bad. Eyes all shut together and Vaseline all over them. And he was cold as ice. And so then I went home, came back the next day. Oh, and they also had him on a ventilator because they didn't want him to aspirate. So that was scary. It was pretty scary to see that tube inside his mouth. He reminded us, my family, my mother especially, and me, of my father before he died. My dad was a very healthy 73-year-old, and like in 1999 he fell, hit his head off of this like 2-step ladder, and he hit his head on the concrete, and then he hit his head so hard that his brain shifted. So he was in the hospital for exactly a week. So looking at my husband, seeing him in the shape that he was, I mean, it just was very scary for us. So all those moments were really tense, and then came Thursday, and then he seemed okay, but then by that night, encephalopathy had kicked in, and he went downhill fast. So by Friday, he couldn't communicate very well. He couldn't move his arms or legs or control his arms or legs. He would speak gibberish. So that was fairly stressful. Then I was told he was going to be transferred to UCLA, and there was more stress because I was at work, and then my husband was admitted where at work, so it's nice because I was able to work and stay focused on other things, then go up and visit him, and that really helped me a lot. So then Friday, they told me they were going to move him, so I clocked out very, very early. And we waited all day, and sometimes the waiting is the worst part. So we waited all day, and he was supposed to be admitted to UCLA Medical Center in Los Angeles, but there were insurance issues. The doctor was covered, but not the facility. And then they admitted him to Cedars-Sinai in Los Angeles. So then, but we waited on Friday, and no move. And they told me maybe Saturday morning, and then I was there all day. They thought in the morning, then they told me at lunch, then they said maybe at 7 in the evening. They were waiting for a bed, but still nothing. And so I came home, and I was exhausted. And then Sunday, I woke up, and then they called me in the morning, and they said that he was going to be transported in 45 minutes. So I took a quick shower, and my son Louis drove me to Mission. And so I got there just in time, and I was able to ride with my husband in the ambulance. And we drove into Los Angeles, and I was so tired I took a nap in the ambulance. And then we got to Cedars on Sunday, and it was a long day. We went through the whole process. And so anyway, and my son Richard was with us at the hospital like the whole time. And then my son Louis was here at home with his kids, helping us with the dogs and making sure the plants were watered and taking care of our pets. And when we got to Cedars, and my son Richard was there again, and then my son Robert was there for him. I spent the night that Sunday, and I couldn't sleep because my husband had the encephalopathy, and then but he was getting a little bit better, so it bothered him that I was there because I have cancer, and then I shouldn't be in that environment. So he just really, he couldn't let me sleep. And then so not only that, but in the background you can hear the ventilator machines with people on ventilators, people on dialysis. So it was a very noisy ICU. And so I didn't rest. And then by Monday, which was already Wednesday, Thursday, Friday, Saturday, Sunday, Monday, 7 days, I was very exhausted, and my friend Vanessa came to visit, and then I came home with her, and I came home and I was exhausted, and so I stayed here on Tuesday. I stayed home because my husband was in Los Angeles, 60 miles away, and then when I came home on Monday, then I took Tuesday off because when I woke up I felt like a ton of bricks had fallen on me. And so I couldn't go to work. I was so tired. So then I went to work on Wednesday. Yes, honey? I went to work on Wednesday, and then Thursday.
Why don't you come outside real quick?
I'll be there in a minute, honey.
That's very cool.
I know. Let me finish my video. So then on Friday, I was at work, and then they called me that you can kind of see my husband sitting back there, and he's just back to normal. He's such a sweetheart. It's gorgeous outside, and it is. So anyway, then on Friday, they called me that my husband was going to be discharged. I was already planning on spending the week up there because the remaining days that he was there, they did every procedure imaginable because we're moving forward with a liver transplant at Cedars-Sinai. But he was discharged, and then he came home on Friday, and it was nice, very nice having him home. And then we had a nice weekend. My boys were here, Richard and Christina, and their kids, Daniel, Vanessa, and Crystal, and then Louis and his 3 boys, Santiago, Adam, and Ziki. So it was really nice. But then my husband kind of overdid it. Then he had to go to sleep. And then Sunday, my sister-in-law Martha came over, and her husband and her grandkids. And so it was a busy weekend. And so and then I went back to work today. Today is Monday, and I do feel tired. This whole experience has taken a toll on me because I wasn't exercising like I normally do. I wasn't eating like I normally do. It's hard when your loved one is in the hospital and you really don't know, what's going to happen. But even, when he's in the hospital and so far away, and so stress definitely induces the side effects of chemotherapy. It's just, I'm due for chemo tomorrow, but I just got up from a nap. I came home. My husband picked me up. My oldest son, Louis, and his boys moved out. So I'm a little sad about that because I miss them a lot. They lived with us since my youngest grandson, Ziki, had just turned 2, and now he's 8. And then my other grandson's 10, and then 15. And my oldest boy is 33. So I miss them a lot. That's a long time for them to live here, then they move. But my son, I'm so proud of him. He's a single dad, and he feels like it's time to move on. And then, but my doors are always, the minute somebody moves out, somebody else moves in. So my middle son Richard is going to be moving in with his wife Christina and their 3 kids. And that kind of, I'm happy that they're moving in. And he keeps saying, that it's okay, but don't want him to change his life for us, because I know for a fact that when you change your life for other people, things around you kind of fall apart. But when you do things for yourself and you do what you think is right, then things around you fall into place. And he keeps saying that this is the right thing to do. But still, as a mother, I don't want him to make a choice he'll regret later. But he's very caring, and he wants to make sure my husband and I are taken care of, especially since I'll have my last chemo tomorrow, this type of chemo, Filforinox, and then I'll have a CT, and then we pray for surgery. So when I have my surgery, I'll be in the hospital for a month. So it makes sense. I just don't want him to disrupt his life for us. But anyway, he says it's okay, so I believe him. I love my 3 boys. My youngest son Robert too. He was at the hospital with my husband when he had to have this procedure, and he had to clean the system all out, and he had to drink he said 14 things of this salty water. And I'm so proud of my son Robert. He stayed with him until he drank most of that stuff. But anyway, stress, back to stress. I just haven't been walking like I used to. Since since 10 days ago, no, 12 days ago, I haven't done 1 3-mile walk. My eating habits were kind of not bad, but different. Instead of having small meals, I would go without eating and then have big meals, and that's not a good thing. My digestive system can't handle that anymore. But I experienced tingling in the fingers, sometimes numbness in my feet. I experienced horrible cramping and horrible diarrhea, and then a headache. And then I've got this weird thing right here inside my mouth. I've got this huge bump inside, and it hurts. So I'm having these symptoms, and then I keep getting these back spasms. And so I've been uncomfortable. It's still tolerable. I can't complain compared to other patients who go through this and then their symptoms are really magnified. I just know that stress can cause so many things. So it's important to try as hard as possible to try to get back on the routine. And then I also know that everything that I've gone through, I know me, and I know that I just got a little depressed because when I came home, I slept. And I got home at I think it was maybe 4:30, and it's now 7:26. So I slept for a long time while I ate and then slept. And then when I was lying there, I had a hard time getting up. I just had to really force myself to get up. I just felt numb, and I didn't want to move. I just felt paralyzed, and I know that's a sign of depression, although it's a mild depression, but I know I have to work on that, which is normal because when you go through such a traumatic experience like I just went through, that stuff is normal. So I know me, and I'll allow myself, but I'll keep an eye on myself because I don't want to get any more depressed, because I need to move forward with my treatment. Tomorrow is my 6th treatment, and like I said, then we need to move forward and see what happens. But stress definitely creates a lot of problems. So I'm going to force myself right now. As soon as I shut off this video, I'm going to put my walking clothes on and I'm going to do my 3-miler. And then I'm going to get back on track, because it's important to do that. Even if you don't feel like doing it, it's important. It's something that you have to do. And then so I've been, since my husband's been home, yeah, he's been getting on my case, so I'm back on track with my eating, and that makes me feel better too. And then I also have experienced nausea in the morning, which I had not experienced nausea at all. I think only one time, and that was way back when I first started this aggressive treatment, and that was the smell of coffee made me nauseous. So yeah, definitely, be careful if you're really stressed out. Sometimes, it's not possible, like with me, with my situation. Even though my son Richard, when we were in Los Angeles twice, he was very supportive in getting me to walk. So he got me across the street at the Beverly Center, and then we walked along. It wasn't like a lot, but it was a decent distance, where I felt the difference. So he did that a couple times with me, and then when they spent the night, we walked. They walked with me one time, and then I walked another time. But I got to get myself on track, especially since I can tell you then that I get a back pain. It's back spasms, and that can be fairly painful. So anyway, I'm gonna let you go because I need to get my jogging clothes on, my tennis shoes, and then my dogs know the magic word walk. They just hear that word. Oh, Choco's behind me, and he just made a noise. So I've got to push myself, no matter how hard it is. I've got to push myself to move forward, to shake this little bit of depression off, and to move forward. And I do know I'm a little depressed because I love my friends and I care a lot about them. But lately, so many of my friends have been going through so many struggles, and lately my heart aches a lot for them, and so emotions are magnified right now. So I want to get myself back to where I've always trusted God, but I got to get myself to that peaceful place where I never stopped trusting Him, but there's just this peaceful place that I find that where it helps me think clearly and emotions don't get in the way. So I've got to get myself back on track. So I pray the same thing for you. If you're going through something traumatic or emotional, sometimes you can't help. Things happen, they're out of your control. But try the best that you can to do the things that you need to do. And then if you can't, once it's over, just pick yourself up, dust off your knees, and move forward. And that's what I'm going to do right now. Okay, love you. And there's somebody at the door. Love you, and God bless. Have a good day or good evening.